just die go so.
I tell you, I just not because say old. Because it's not only old they get a breast cancer.
Which old? My life was if they which age? How many? No, not only 40 years. I beg forget that one. No.
Zeleny no. Something is so ashwabi. That means you really like that your madam.
Madam favorite girl.
Madam favorite.
But if it be say na the of a perfume madam may possibly be spray and I clear. Because when that madam pass for you, all man you know say that man don't pass. If it is spray the kind strong perfume then so
Perfume breast cancer.
wow.
No. The way me I check for thing no. If it be na over sugar and salt, it because that madam Biki over take sugar and salt, and I don't say Biki go visit my life all the time no. But because they give me chop of excess salt, you need if even chop and fine. You only go just chop and I just because say no. I not just say the chop not fine. And if you egg you tea no, milk, sugar,
Wow. Well, if the madam is favorite student, so if you talk, we know if you argue.
Wait to my friend, I just know now witchcraft kid that man is. Now witchcraft kid that madam. No, because we know first that man have fine so I just the show where that singer for that village.
Oh,
madam fine. True, that fine. That fine no.
And I just left the argument, so now don't forget say my other standards. When he come back, we go ask.
So if he come which time?
If he comes tomorrow time, I just say by 9 we will be
Okay, because just now witchcraft.
No, who ask
can't
my
clarify like that. We can't.
She's very common.
Wow, now you don't say back. Don't say welcome. I don't come back. Don't forget something. I want to be LMD.
I'm not saying you don't tire for work today, but no vex. We want to ask some small things. You feel me, madam and madam will tell you, no, madam may possibly of breast cancer. So don't you want that if my friend he talk say na sugar, na salt, me I think say my own na perfume. The other one say na witchcraft. So as you be next sister beg help now which if you really cause that breast cancer wey die.
So una the mean say una the thing say all the things so they cause breast cancer.
Na so we
Yes. Actually, when we talk about breast cancer, we not really talk about the way it cause breast cancer because scientifically they don't have it for proof say the particular thing or the one they cause breast cancer. But we talk about risk factor then when we talk about breast cancer and all other cancer then we talk about risk factor it means say something the way it put you at more risk of developing this breast cancer. And when we talk about this risk factor then we put am into two categories. You get risk factor then where you fit modify am as a person and then you get risk factor then where you no fit modify am means say na natural risk factor then. One of these risk factor then where you no fit modify am be non-modifiable risk factor for breast cancer e be na age because we don studies dem don show say people dem wey dem be older especially women dem dey be at higher risk of developing breast cancer especially after the age of 50 but nevertheless we don dey see am no be una madam e no even reach 50 years so we dey see am say na just risk factor age na risk factor e mean say e dey place you at higher risk of developing breast cancer. Another thing too na family predisposition. You fit comot for family wey your first line relative dem when I talk about first line I talk about your sister, your mother, your daughter. Now if that category of people they don't get breast cancer before, it place you at higher risk of developing breast cancer. Jesus. Another thing too, na multiple people there for your family, the way they don't get breast cancer, whether from your mommy side or from your papa side. If you get plenty people, them even man picking them too from your mommy side or from your papa side, where they don't get this breast cancer, then it place you as a person at higher risk of developing breast cancer. But like I talk now, risk factor then this not be actually thing the way that they cause breast cancer. Some will not go be confused yourself. And then when we talk about risk factor, then we will fit modify them as a person. You will see say being person where it be where not be physically active, it be at greater risk of developing breast cancer. Another thing too, you will talk about alcohol use. Person where it be consume alcohol plenty, it place you too at the higher risk of developing breast cancer.
Thank you very much.
But so I beg, how person fit do know say get breast cancer?
1 year that one.
Okay, breast cancer no be death sentence. the most important thing for breast cancer na for we diagnose am early, but because when we diagnose breast cancer early, we fit easily treat am. But when you come for hospital wey e don already go advance, e don already spread to other part of the body of your skin, we no fit to easily manage the breast cancer. So the most important thing na for first of all know your normal breast, how your breast first of all dey. So you all una so una be younger than always will be younger than. So you get to know the consistency of your breast through some process wey dem call am say self breast examination. E get some technique wey you go lie for bed, you put your one hand for up, then you go use this your other left hand. If you be right hand person, you go use this your other left hand. You go use am to feel your breast. You go palpate am, like for big book they call am say palpation. You go feel your breast for see the consistency of your breast, how your breast be. You feel to your under armpit because breast cancer dem too they come as nodules dem for
under your get that thing for your armpit.
Yes, so you can feel your breast and your under armpit. If you notice any inconsistency, maybe you notice some lump wey you don dey feel your breast, you never dey notice that lump before. You notice some lump dey for there. You notice say your nipple e dey discharge. Maybe if e dey discharge anything wey no be milk, anything wey dey comot, maybe blood dey comot from your nipple. Na some of the early signs dem of breast cancer that you fit to notice say your breast symmetry don change. Maybe your breast dem be dey fine, then you wan can look mirror now, you dey notice say your one breast don big pass the other one. Na warning sign that for breast cancer. Or you notice say your breast don start red for some particular portion, or e don start shrink for some particular portion. And then some very common symptom wey you go notice am na dimpling of the breast. You go see your breast go start get some kind hole dem like orange, like peeling for orange. Yes. So when you notice that thing dem, so na warning sign dem that for breast cancer. Run go for hospital. When you go for hospital now, you meet up doctor where you will do you now clinical exam of your breast. From there now, if you proceed to do mammography. When we talk about breast cancer screening, mammography now one of the most reliable source then we will feel you use and for early detect breast cancer. When you go now, they will snap your breast, they will do X-ray of your breast. Yes. Now from there they fit notice if any particular thing dey with your breast when I cause for concern. From there now, if we detect am early through that method, then so we will see say we will fit for treat your breast cancer. So till you go there you find breast cancer no be death sentence. Wow. The problem now say people then they stay with am for house, they dey notice changes for their breast, they dey stay with am for house, so that they one can way that breast cancer, the cancer now don spread to other parts of their skin. Now it will be very difficult to treat am. So when you notice that changes, then the first thing na for go for hospital. So na the in a nutshell na thing that we will be doing for breast cancer screening. E no hard, na just simple something so that e go help you to know as your breast dey. So that if you wan examine am another time, you notice something wey you never dey notice am before, you go fit for easily.
You don't really tell me.
God will bless you.
Wait, so I just one question again. When don't go hospital now, so they don't detect, and when they treat and your breast will come back the same.
Obviously, if we don't detect your breast cancer early, possibility then dey very well say they go treat you and you go dey fine. Treatment option then for breast cancer, you fit get chemotherapy where they use particular medicine dem, they pass am either for your IV for your vein, or they give you the swallow am as tablet where you go shrink the cancer cell dem and they no fit to dey multiply, it will kill them. Or we get to hormonal therapy, we get to radiation therapy, all dem na treatment option dem for breast cancer.
You see plenty option dem really.
Yes, but for some other cases then they do surgery where you get some oncology surgeon, e go go now, we go operate your breast, e go move the breast cancer tissue there. All of them. The problem, the easiest thing, the problem where they be for them to detect the breast cancer early. Breast cancer not be death sentence.
So if people know,
Thank you very much.
I do that. That's it. Example. No, but
me say something I go do and
Una spread the word. Una tell
I will tell
my friend